I'm so happy to be able to share this important information with everyone at Health AIM International Business Times. You know, the risk for prostate cancer is being a man. It turns out, prostate cancer is one of these diseases that you don't really have symptoms unless it's too late. So for early prostate cancer, there are no symptoms. So you have to go to your doctor to get screened. And you really should talk to your doctor about the PSA test and whether you need a digital rectal exam. Because the more information you have about prostate cancer, the better it's going to be for you, at least with early detection and treatment. Well, it's important to know that prostate cancer is one of the most common cancers out there. In fact, 1 out of 7 men will get prostate cancer in their lifetime. So it's important to know that there are other men that have these issues. It turns out it's the second leading cause of cancer deaths in men. So in terms of dealing with these issues, well, listen, we have to be men. So we have to really understand the truth about these things, be aware of it, and get diagnosed and treated if need be, and man up, if you will. It's a very important point of when men should get tested for prostate cancer. We know that it occurs later in life, and a lot of men who are older don't get tested. And it turns out that men get prostate cancer early in life and die of the disease. So if you've had a family history of prostate cancer, particularly if someone in your family has died of prostate cancer, you should get tested early on, and as early as 40 years old. In my practice, you have to talk to your doctor about your individual risk of getting prostate cancer. And again, if there's a family history or if you're an African-American male who tends to have more aggressive prostate cancers, tend to get evaluated in your 40s. But in general, as people move on in age, 50s and 60s is when we see most of the prostate testing. A PSA stands for prostate-specific antigen. It's a protein that's made in the prostate that can indicate whether you have a higher risk of having prostate cancer, but it also gives you the risk of having an enlargement of the prostate or an infection of the prostate, all three. So it's not the most specific. So what's really important is to know whether there's a rise in the prostate-specific antigen, the PSA. Because if you're seeing a large rise over a year, that may be an indication that you have something serious going on, and you really need to talk to your doctor about the different ways to detect prostate cancer and treat it if you have. What's important to know is whether you actually have an aggressive form of prostate cancer. That's why we have this new test, a more sophisticated PSA test, if you will, and that's the 4K score test. The 4K score test tells you the chance of you having an aggressive form of prostate cancer. That's prostate cancer that could actually kill you. And it actually, this test can allow you to avoid unnecessary testing, because it turns out 3 out of 4 men, who have an elevated PSA and get a prostate biopsy do not have cancer. So we want to avoid those 3 out of 4 that don't have prostate cancer, but yet still get biopsied, because these biopsies can have an ill effect in men, such as an infection. Now, if you do have prostate cancer, then the treatment for many men can be either surgery or just observation or radiation therapy. And there's new treatments coming out there with high-intensity frequency ultrasound. So you really have to talk to your doctor about the treatment for prostate cancer if you have it. If you have an aggressive form, you will need to be treated. But you have many options out there that could really allow you to maintain your fertility. Am I a candidate to be screened for prostate cancer? In my practice, that answer is yes, but you really need to talk to your doctor about all the risks and benefits about being screened for prostate cancer. The screening is incredibly easy. It's a prostate exam, a digital rectal exam. It takes about 5 seconds, and a blood test for a PSA test. Now, if the PSA test comes back elevated, wait. We recommend getting the 4K score test, which really gives you a better indication whether you have an aggressive form of prostate cancer and may limit and may improve the ability to screen men for prostate cancer. Prostate cancer a lot of times develops on its own. Again, if you're a man, you have a chance, a 1 in 7 chance of getting prostate cancer in your lifetime. But a better diet and exercise program is very important. People who tend to be overweight, have a high cholesterol, not only is that bad for your heart, but it's bad for development of prostate cancer. So a heart-healthy diet is really also a prostate-healthy diet. Now, in terms of diet, we just want you to avoid certain foods. I like to say no breads, pizza, pasta, cookies, or cake. If you avoid those foods, chances are you're not going to get that belly, that excess weight, and they'll be helpful for prostate health. For more information about what I've said, you can go to 4kscore.com or 4kscoretest.com. Both of them will give you the information.